Dr. Terry.
All right, thank you. You said something about the studies and zero infections, and I wanted to make a statement, let people be aware of some things that during my research and all this, and I just wanted to see if this lines up with what you guys, it sounds like what it lines up with what you guys are saying. So earlier, I guess end of last summer, a hospital sent us some information about patients that they had taken care of in their hospital, and at the time, I think it was 1,508 patients they'd taken care of inside their facility that were hospitalized. Of that, 98 had been vaccinated, 1,410 had not been vaccinated. And so the implication, obviously, is the decrease in your risk if you're vaccinated. But I asked the follow-up question, and the question was, of those 1,410 that have not been vaccinated, how many had had a previous infection? What was my answer? They couldn't tell me anybody. I had several questions after that for several months asking if you can follow up, can you give me anybody that's been there? The answer has been no. I asked our Department of Health if they had been studying that, and that was not, they did not begin studying that until September. I do not have an answer from anybody that has been hospitalized after a previous, like an alpha infection or whatever. So is that similar to what you guys are hearing?
So that is correct. We are not finding people reinfected in the hospitals. It's very low. It's been seen. It's looked at one country, I think it was Abu Dhabi, Qatar actually, looked at this. It was almost 0 patients that had been reinfected that re-entered the hospital. I think it may have been one who did well. So these patients who are already naturally immune are not turning up with illness. Omicron has had a lot of people who already had the virus have a mild cold-like illness. I don't know of anyone who's actually passed away after having Omicron and been previously infected. So we are seeing Omicron breaking through on both the vaccinated side and the naturally immune side. But these are on the naturally immune side have been very mild infections. What we're seeing in England is the triple vaccinated are dying from Omicron. So we are seeing that. We're also seeing the numbers from 2021 where 40% more deaths occurred from 18 to 64 for some reason. Who knows why, but it's 2021. That data is a 1 in a million type of data. 10% increased deaths would be a 1 in 200 year likelihood, but this is 1 in 40% increase in deaths is never before been seen.